Hello, my name is Dr. Ed Huey, Clinical Chief at the UCLA Center for East-West Medicine in Los Angeles, California. I also provide care in our East-West Medicine Clinical Service line at the Chinatown Service Center, CSC. Together with colleagues at UCLA and CSC, we are advancing culturally responsive integrative health through an academic-community partnership. The UCLA Center for East-West Medicine, founded in 1993, is one of the first academic integrative medicine centers in the United States. Our model emphasizes safe, effective, and affordable care that integrates the best of biomedicine with traditional Chinese medicine, including acupuncture, lifestyle, and self-care practices. Since 2021, we have partnered with Chinatown Service Center, CSC, a federally qualified health center serving more than 35,000 primarily Chinese and Latino patients each year, generating nearly 200,000 annual visits across health and social services. Our collaboration has three main goals. First, to make integrative medicine services available and accessible for under-resourced immigrant patients. Second, to use CSC as a platform for medical education that builds cultural competency. And third, to establish a site for research on health disparities affecting immigrant communities. The implementation has unfolded in phases. In 2021, we began with UCLA student programs on culturally appropriate care. In 2022, we launched an integrative teaching clinic. By 2024, we had formalized a clinical services agreement and expanded into behavioral health and oral health. This work has required dedicated bilingual integrative medicine physicians, licensed acupuncturists, dentists trained in dental acupuncture, community health workers. Partnerships with David Geffen School of Medicine at UCLA, the UCLA School of Dentistry, the Los Angeles County Department of Public Health, and the Cyrus Tang Foundation have been vital in supporting these efforts. The results of this collaboration can be seen across clinical care, medical education, and community programs. The Integrative Medicine Teaching Clinic now delivers about 300 visits each month. With grant support, we will be introducing culturally congruent music therapy programs. And in dentistry, we have integrated the East-West model for oral health with plans underway to establish a general dentistry residency. On the education side, UCLA medical students, fellows, and visiting trainees engage in long-term community projects, health disparities research, and culturally responsive care. For the community, we've developed Spanish and English self-care videos on topics like Tai Chi, mindfulness, and acupressure with Chinese subtitles underway. Community-driven mental health initiatives, and an upcoming Healing with the Senses Festival in 2026. Of course, challenges remain. Sustainable funding, workforce retention, and scaling innovations continue to be obstacles. Yet despite these limitations, the response from both patients and students has been overwhelmingly positive. Patients report that they feel culturally understood and experience improvements in pain, stress, and well-being. Students consistently share that the experience has deepened their humility and their commitment to serving diverse communities. The partnership between UCLA Center for East-West Medicine and Chinatown Service Center demonstrates how academic innovation can align with community service to advance health equity. By combining integrative medicine with culturally responsive care, we are training the next generation of clinicians, addressing chronic disease and mental health, and promoting wellness in under-resourced populations. We believe this is a model that can be adapted and replicated to bridge academic medicine and community health systems worldwide. Thank you so much.